So let's talk about crystalloids. So there are different types of fluid. There are colloids and crystalloids. And we're going to talk about crystalloids first. And basically, crystalloids contribute to osmotic pressure. They have noticeable effects in the interstitial space, but they do not stay, so we place them in the intravascular space, but they do not stay long-term in the intravascular space. Basically, they go straight from the intravascular space and into the interstitial space. And at about 1 to 2 hours after administration, most crystalloids have moved into the interstitial space. At about an hour, 20 to 25% of the volume that you have administered still is in the vasculature. So these are good for rapid, quick rehydration, but it depends on the type of dehydration that they have. Obviously, this is not something you would use in a hypovolemic patient because of the type of fluid loss hypovolemia is. So let's talk about the types of crystalloids. There are 3 types: isotonic, hypotonic, and hypertonic. The first one we're going to talk about are isotonic, and these are basically like replacement fluids. So the most common replacement fluid there is a 0.9% sodium chloride. This is actually normal. As we sit here right now, our body is pretty much 0.9% sodium chloride. As a matter of fact, if you put red blood cells in sodium chloride, they will just stay red blood cells. They won't lyse and they won't shrink. So sodium chloride expands the plasma volume. You can use this to correct a low sodium level, and you can also use this to correct metabolic acidosis. Sodium chloride is just sodium and chloride. Lactated ringers is another commonly used isotonic product, and this is saline and lactate, and they have electrolytes in it. So basically it's sodium, potassium, chloride, calcium, and lactate. The problem is that lactate converts into bicarb in the liver, so you need to make sure you're not using this in patients who are liver compromised. You can use this to treat acidosis. It's pretty much a common standard fluid. For surgery, if there's nothing wrong with the patient, lactated ringers is probably the fluid of choice that your clinic is going to pick. So on to hypotonic crystalloids. Hypotonics are maintenance fluids. So basically with hypotonic solutions, this is diluted down from the 9%. It would be something like 0.5% sodium chloride. And in approximately an hour, about 10% of the fluid that you have administered actually remains in the vasculature. So these fluids have less concentration of sodium in them. So basically what happens is it dilutes the extracellular fluids, the sodium that's in the extracellular compartment, and that portion moves out of the intravascular space and into the extravascular space. So some things that you might see: 50% dextrose and H2O, which is D5W. If you think about it this way, 2/3 of this goes into the intercellular fluid and 1/3 goes into the extracellular fluid. Then there's 0.5% sodium chloride. This could be used for maintenance. There are some things you need to remember about this though. You should never use maintenance fluids for a bolus. The reason is it can cause edema because it's basically it's filling everything up, right? Hypotonic pulls everything out, okay? Hypotonic puts everything in. You need to make sure you give these at a slower rate, so you certainly would not be giving these at, say, 100 mLs per hour. And then the final type of crystalloid is hypertonic, and this is where it has an increased amount of sodium. The increased sodium concentration in the extracellular fluid. So basically the water moves out of the cells and into the extracellular fluid. So the cell shrinks. They use these to draw the fluid out of the cell rapidly. It's used to treat shock as well as edema. This helps to reduce the edema. They use it for fluid in the lungs, those kinds of things. Hypertonic is only in the vasculature. It's very transient. It comes out rather quickly from the vasculature. 0.9% saline with 5% dextrose. This is considered a hypertonic solution. And then 3% sodium, obviously more than the 0.9% sodium, is a hypertonic solution also. Later this week, we're going to be playing with, we're going to be doing a lab experiment that kind of shows you how hypo, and isotonic solutions work. Thank you.